Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. I get so many questions about TMD or temporomandibular disorders. Patients will call it TMJ. And I have a few humble suggestions. As a whole, I would like our profession to move away from treating the teeth and get a little bit better at treating the etiology, which is often stress-induced. Most TMD is muscle-induced hyperactivity due to stress. And really, when we're dealing with joint problems, we're dealing with muscles, ligaments, and bone. Now, this is not to say that teeth can't have a small role. We know that there are interferences. Sometimes dentists will call them noxious stimuli. We've also seen things like fremitus, where someone has a parafunction and they're clenching and they're banging on a tooth and that tooth becomes hypermobile. But what I'm talking about is joint problems, joint pain. From mild functional pain progressing to anterior disc displacement with reduction, to anterior disc displacement without reduction or locking, and then eventually progressing into osteoarthritis. So if we can catch TMD early, usually around adolescence, maybe even pre-adolescence, you're seeing kids get stressed earlier now as social media becomes a bigger part of their life. If kids are on cell phones, as school becomes, there's more pressure with school, and as relationships begin to start, you'll start to see a lot of kids who are braces age experiencing signs of TMD. Also be careful with heavy class 2 elastics or functional appliances, which I believe can exacerbate these conditions. So what I like to do when I have a patient who's showing early signs of TMD is address the muscles, okay? And I think it's the best approach, it's the most holistic, it's the simplest approach. And the way I like to do it is, one, make sure we're not doing any heavy class 2 elastics or there's no functional appliance in. But I also like to talk to the child about stress, about reducing social media intake, making sure their phone is put away when they go to bed and they get a good night's sleep. Try to exercise before they can go to bed. I don't like to prescribe Flexerol, but I do like to talk to them about self-care and really focus on holistic, palliative, free treatment. I always say this, I say, stress makes us successful, right? It gets me up early in the morning to get all my work done. But if we don't manage our stress and learn to get good at managing our stress, stress can break our bodies down. And it really, when you see people really struggling in life, that's them unable to manage their level of stress. So I talk to children, when we're getting TMD pain, the body's telling you your stress level is above the threshold, and we need to do things to try to take it below that threshold. So my favorite things to tell the kids to do is, again, reduce screen time, try to get to bed a little bit earlier, exercise if you can, obviously chew less bubble gum and some of those activities. I actually believe diet can have an impact, so I'm a huge believer of like food allergies, and we can talk all about that stuff later. But try palliative, conservative treatment. And the pearl here is, rather than throwing expensive appliances at people, okay, do things to relax the muscles, okay? Remove orthodontic appliances that could be worsening those problems, but also talk to them about home care and techniques they can do to relax their muscles. And oftentimes, if you can do that, if we can reduce the muscles and we can reduce the stress, a lot of times the signs and the symptoms of TMD go below a threshold. Let me know what you think about this pearl. Thank you guys so much for subscribing to this page. Thank you for supporting the JCO.